My name is Dr. Mmuso Mogwera. I'm an interventional cardiologist based in Rustenburg at the Rustenburg Heart Centre, that is in the Bojanala area in the beautiful province of the Northwest. So, most people don't know this, but I'm a Rustenburg boy. I was born in this town and I went to school down the road from the hospital that I work in. But why Rustenburg? Obviously, personal reasons, because it's where I grew up, where I'm more comfortable. But as I was at the training institution at Baragwana, we used to get patients from Rustenburg area who would have traveled more than 300 kilos, because then they will be first referred to Klerksdorp. Klerksdorp will then refer them to Baragwana hospital. And to me, it didn't sound right that we have a town as big as Rustenburg and we don't have a cardiologist and we don't have cardiac services in there. Then I took it upon myself to say, let me go try to see if I can serve my people in Rustenburg. We started very slow by trying to build up a cardiac unit. We started with small procedures first, teaching the nurses how cardiac unit works. I mean, it's not only about the theater, the post-operative care also is important. Then obviously we started only doing the private cases, private hospital cases. But then it also now was not fair to those who didn't have a medical aid. That yes, if you have money, you could be treated. I am passionate about decentralizations of all specialized services, but specifically cardiology services. It does not make sense that a patient who has a heart attack in Rustenburg should only be treated in Johannesburg. How do we make sure that each province can serve their people in their own province? And that cannot only be done by the private sector. It needs companies like SA Medical, who are influential, to request meetings with the policymakers in the country to make sure that we have proper cardiac services in each province. The money that you spend transporting a critically ill patient from Rustenburg, taking them to Johannesburg, it's more than what you could have used if you have a cardiologist in the center, treating the patient close to their loved ones, where they can be visited when they are in ICU, where they are more comfortable with. The physical treatment of patient just forms a part of their treatment by giving them medication. But the psychosocial support when they leave the hospital, when they are in hospital, if they see familiar faces, that improves their recovery. And there is literature that proves that, to say when you are treated in an environment where you are comfortable and you have support, you are likely to recover quicker. So Rustenburg is very close to my heart. We have the services here and we are growing our center. I started the cardiac center in Rustenburg, but at the moment I have two other partners, Dr. Rapala, who's an adult cardiologist, and we also have Dr. Msiza, who's a pediatric cardiologist. So our center is growing. We're hoping that we will get more members joining us and we can have a one-stop shop in our Rustenburg Cardiac Center. So, why medicine? Very interesting. I was still in, I think, grade 5. One of my cousins, Dr. Ditsile, qualified as a doctor. I went to that graduation and something in me, I was like, I want to be a doctor. I was seeing young people celebrating that they are doctors and all that. And from that day, we never lost contact with Dr. Ditsile. He always checked up on me, how you doing and everything. And I kept on saying, what do I need to do to be a doctor and all. Then passed my matric and I was like, I want to be a doctor. Got accepted for medicine, did my undergraduate at Medunsa. At that time, it was known as University of Limpopo Medunsa campus. Qualified there, like any other doctor, did my internship. Now, during community service, I went to Potchefstroom. And there I was working with the first black cardiologist in South Africa, Professor Mogwera. He was doing all these fascinating things on patients, and patients were getting better, but he wanted us to be hands-on. He would allow us to do cardiac sonars. He would be doing temporary pacemaker, and he will sit there and says, you are doing this one, and we'll do that. And then said, this guy is making a difference. Where you see someone coming in with a heart attack, they are in pain, and immediately you open that artery. Doctor, what did you just do? The pain is gone. And you see the results immediately. That was driving me to cardiology. How does one get to be a cardiologist? I said, no, you have to do internal medicine first. Went to vets, started my internal medicine journey. Internal medicine, you do a rotation in cardiology. I loved cardiology at Barrow. Very demanding 3 years, but I wouldn't trade it for anything else. I enjoyed my time there. Like I said, we had very robust seniors. They were always there and making sure that you need to know something. Questioning you, at some point we thought it's a military training. It was hectic. Then post that, I took it upon myself to say I want to upskill. My biggest concern was that I am serving a rural community. I am 2 hours away from the big centers, and it means that I must be able to do most procedures, and I should be able to rescue myself if anything goes wrong in the theaters. And I'm thankful for the people I've met in this industry. A lot of people have supported me. A lot of companies have spent money on me and have spent money in training me and in training the staff around me. And that's why then I decided to be a proctor. I go around the country helping those who are junior to me, trying to give them the same skill that I was given, and passing on the skill. Skill transfer is the biggest thing that we need to do in cardiology. Unfortunately, cardiology, you can't do it by distant learning. You need someone to show you how to hold the wire, how to do things, and you need someone who you can always call when you don't know what to do. Different opinion will help the patient. It's not about ego. You can never be a good cardiologist if you are egocentric, because like we say, more eyes are better. 8 eyes, if you have 4 other people looking at the same case, they will see it differently and they will give you different advices, and then you can take whatever works from their advice and make sure that it works for you. So one of the things is that I always say to my patients, once we have touched your heart, we have our signature in your heart. We have our stamp in your heart. So once we have seen a patient and the patient has been operated, that patient becomes part of our practice for life. My journey with SA Medical, I think was 3 months into private practice. They asked to see me, told me about their products and provided scientific evidence of their products. I had already been acquainted to their products. As a senior professor of mine was using their products, and when they came in, they introduced, I said, yes, please, bring in some of your products. Let's see how we can use some of your products. And every time I needed support on education to say, guys, there's this congress that I need to attend, or I need you to bring this guy in to come teach me this. They were willing to come in and say, we can support you with this. We will be able to support you going for this congress so that you can learn and broaden your scope and be able to offer your patients better quality care. So it has been a very good relationship, and support-wise it has been there. And going forward, I foresee that we're going to continue having a very good relationship, and I wish them all the best in the industry.